Thank you. Yes, welcome everyone. Thank you for joining us for today's session on digital connection and reimagining patient outreach. If you guys are just joining us, again, my name is Tiana Taylor. I am the clinical program manager here at CareMessage, the part of the strategy team, and I am very pleased to be joined by a very special guest. So if we could take a moment, do you mind sharing your name, your role at your organization, just so you can, introduce yourself to our lovely crowd today?
Sure. So my name is Elizabeth Leffler. I work at Pokagon Band of Potawatomi Indians. We're located in Dowagiac, Michigan. And I am the community outreach supervisor for the site.
Thank you so much. Yes. And again, if you guys at any point during our discussion today have any questions or anything that you want to share with us, please drop that in the chat. We are very excited to get to speak with you all today, and of course, get to speak with Elizabeth on her experiences working in this space. So we can get right into it, Elizabeth. So I'll start with asking you a really core question, I guess, that a lot of people can, I guess, like really resonate with, right? Which is, what do you think it is that keeps you motivated? I guess working in your space in general and specifically addressing colorectal cancer amongst your patient population.
I think what kind of keeps us motivated is just we really want to make a difference for our clients. We want to be able to get them in and get them screened for preventative care. We in our department do a lot of education-based type nursing services, and then we also do a lot of preventative care with our clients. And so it's important to us to be able to catch things early so that way we can get them, appropriate treatment, so that it doesn't get to be worse down the line where, then people are suffering more from that. So a lot of preventative care, and we really take pride in that at our site.
No, I love that. I love that because preventative care really is like that first it's that first like preemptive strike that you can make with not only things like colorectal cancer, but other long term illnesses and diagnosis and things. So it is such a very intentional way that you have to go about reaching your patients at that time too. And it makes my heart so warm getting to hear like health centers like yours that are taking that step and are being very intentional about it, especially knowing the anxiety and things that patients can have, even like navigating the spaces. And that you guys are taking those measures to really walk with them in that preemptive stage. So I love that. I appreciate that answer as well. And then from there, I guess I can move forward to the next question that I have for you. Again, you guys, please be sure if there's anything that Elizabeth says that resonates with you or strikes a question for you, to leave it in the chat or to ask it in the Q&A section, and we'll be sure to talk about that or get to that towards the end of our session as well. But yes, okay, so the next question I have for you, Elizabeth, is prior to using CareMessage, how did you normally interact with your patients as you helped them to navigate their screening options?
So prior to using CareMessage, we were doing a lot of phone calls, like trying to just reach out to people via phone call when they were due for certain screenings. We would try to catch them when they came in for their regular clinic appointments. And sometimes that could be difficult, because people are trying to get in and get out of here. And so it wasn't always easy to catch them when they came in. And then on the phone calls, again, it's a technology era where we're kind of switching to where nobody wants to have a conversation on the phone necessarily. They want something quick and simple. And so they want to get a text message or they want to respond back to in that way. And it also, prior to CareMessage, it was more time intensive to have to do those calls like individually one by one. But that was primarily how we were doing it.
No, I resonate with that a lot. I know even in my time and I worked in the FQHC space as well. I remember the list of the calls that I'd have to make to do things like, getting patients to come in for their diabetes screening, every 6 months and things. And oh my goodness. Yeah, the phone tag was definitely, it was a big thing. And then it's, technology, like you said, like, we're wanting to pivot to reaching patients in ways that, are more comfortable for them, and, taking into consideration the time that they have. They may not be able to answer the phone or get on the phone with us as easily. But it is one of those things in the clinic space that can be really challenging to navigate. So I'd love to learn more about, how has using technology and messaging in particular really changed the way that you support patients in their care now.
So one of the things that CareMessage has helped us to do is to reach like a larger amount of people in like group texting fashion, where we were doing those individual calls pretty consistently. Now we can send out like group messaging. We use CareMessage for a lot of different things. Like we use it when we have closures due to weather. We use it to communicate different events and programs going on within our facility. And then we also use it for our cancer screenings, immunizations, and preventative care type services. So I'd say it has saved us time. And then it also allows us to reach like a more, broader stretch of people a little bit quicker as well.
No, I love that. I love that, especially if you know that patients are using their phones even to like communicate as a part of their day to day. It becomes a part of you guys become a part of their day to day more so, right? And then they're getting that increased awareness about the things that are happening at the health center. I know because even thinking back to, like, I know my doctor's office, everything that they always had going on and any resources they were always on like this bulletin board in the main lobby area. So it's like getting to see the text messages is like the bulletin board that comes to them, right in their phone. They get that little ding, and now they know everything there is to know about what's going on with the health center, who they can call for this and that. And it's really cool. And it really also is showing how you guys are taking those steps to reach patients where they are, and how CareMessage and technology in general is really helping to facilitate that. So I love to hear that. I love that. I love that. And I guess with that as well, would you be able to share a story of a time where you felt like utilizing technology in this way really helped to facilitate a really big win for you guys, either for your work or if you can think of the life of a patient that you may have been supporting, or the lives of patients that you were supporting, if it's more than one?
Yeah, and this one's not colorectal cancer, but it is a big one that we thought was a good win. So we recently brought a mammogram truck to our location and did like an on-site mammogram day. And we used CareMessage to send out a message to our patient population that would be of the age to need mammograms. And so we had a big response to that. And we're able to fill those 20 spots right away. And the biggest win of that is that all 20 of them showed up for their mammograms on the day that we did it, which is, as everybody knows, that can be surprising. So this year we're actually going to run 2 of those mammogram trucks on site. And we are set to have our CareMessage message going out next week. And so hoping to fill those 40 spots for this year as well. We also have used it for those people of the age to get a colonoscopy. Like we also have used it for that, to see if they want to do like a Cologuard or a FIT test, or if they want to be scheduled, that they can go ahead and reach out to Heather. Heather primarily runs our CareMessage, our care messaging generally, but she's on vacation today, so I'm going ahead and covering for her. But she does a really good job with it. She gets a lot of good responses back from people reaching out to her from getting that outreach. But that was probably our most successful one, and we really were happy to see that.
Yes, that just made me so happy, especially too. I know that you guys are going to hit the 40. I'm manifesting it. That is going to happen. And that is it's so powerful too that you guys have been able to use it that way to really drive engagement with your patients and to see that it really led to them not only engaging with it, via text, but then they showed up and they engaged in that part of their healthcare, a preventative part of their healthcare, because screening is so important, especially if you guys, were with us in our last session where we were going over, the different aspects of the colorectal cancer program and how we're taking the time to really, get patients to that screening phase to see even when it, isn't pertaining to colorectal cancer, but to breast cancer is so powerful. And it just goes to show how this is applicable for, many other things, even beyond the conversation that we're having today, which is absolutely, absolutely amazing. And I love that so much. And I'm hoping that, our audience is also inspired too by the impact that you guys have been able to make, even with that project, that program that you guys are running, and that you guys can see how this could be applicable to you all in your spaces and whatever goals that you have for your patients as well. We have some questions in here. I see Cecilia has asked, are there other ways you've leveraged mobile clinics to expand clinic services and offerings?
So that was kind of our first mobile unit, and we offered it last year. So like again, we expanded it. So we haven't really done a whole lot with a lot of mobile stuff. We are a unique setup, being a tribal agency. So we do some screenings and things out at some of our events that are taking place here. Like we'll go out to their powwows that they have a couple of times a year, and we'll do like a health tent. We do some screenings, some blood pressure checks, and different things. And then we also just provide some education. Like we have some fun games and ask some questions like around health related. But other than that, we haven't dove any further into the mobile units.
Gotcha. No, thank you. Thank you for providing that insight. I'm excited to see how you guys are going to continue to expand and things with it as well. I think you guys have shown that been able to really reach your patients with the breast cancer initiatives and the screenings with that. And I just see, such great things continuing to blossom for that as well. So I'm excited for you guys. I'm so excited. We have another question here coming in. I see, how has automating the routine outreach freed up your staff to focus on those complex human interactions that may require like a bit more intensive navigation, if you can think to a time?
I think that it has freed them up to spend more time like with finding resources and navigating patients. Like I can give you an example around like the mammogram. So a lot of the calls that we received were people that could utilize the mobile mammogram unit and could come on site here. But we do, like, again, we're a little bit unique because we have tribal citizens that use services, and we also have some expansion patients which don't have the same insurances. So there were a few people that couldn't necessarily utilize that mobile unit here on site. But we were able to kind of use our staff and free them up to navigate some of the reasons why they're not going to get their mammograms somewhere else and trying to work through that with them. Like we were able to, those people who didn't have the insurance to cover, we were able to set them up with a program to get that covered for them to still get their mammograms. And so that has been useful. I don't know if that fully answers your question, but we've freed up our integrative, or Heather, who works on this program, and she actually is focusing on some other areas for us as well. So she's been able to not like spend the bulk of her day making phone calls all the time. Since she's able to reach a lot more people, she's freed up to work on some other projects for us as well. And like one program she's working on is our smoke-free homes program, where we're trying to educate people on the importance of like smoking outside the home instead of in the home, things like that.
That was perfect. Yes. No, thank you so much for that. And I think that really ties back to even what we got to talk about in our last session about how the programs, one of the things that we also really take into account with just the platform in general is how we're able to create a framework or the way that the program is set up so that it can really help you guys with being able to tap into those other, aspects of your work as well, and to give your attention to that too. Because, using the technology and using the platform is allowing you to reach patients, more quickly, or reach a broader amount of patients easily, so that you may be able to focus on, a patient that may need, a bit more attention, or a group that may need, specialized, trained eyes specifically on that. Especially because we also know too that, the workload of our nation's safety net organizations continues to grow by the day, by the second. And we want to do anything that we can to make, your work and your everyday as impactful as it can be. So that makes me really happy too that you guys have been able to use the technology and use CareMessage in a way that's allowing you to really stretch your reach and reach more of the patients and their needs. So that is so awesome. Thank you so much, Elizabeth. I have a final question for you, and then of course we'll continue with some questions that may be coming in from the audience. So many staff may be hesitant to use messaging for a topic like this. So what is one piece of advice you would share with someone who is maybe unsure about adding a tool like CareMessage to their communication toolbox?
I guess the biggest thing that I would say is that you have to reach the patients where they're at. And I think that the honest thing is that a lot of people, whether we like it or not, are shifting to wanting to text. And so if you have no other way of communicating, in that way, I think it's hindering your ability to reach people kind of where they're at. One of the nice things about it is that if somebody doesn't want to receive the text messaging, they can always opt out at any time. So we have had like a handful of people that have opted out. So you're not really making people too frustrated, because if they don't want to get the texting, they can opt out at any time, and they can opt back in at any time as well. So that's what I would say to that.
No, I agree with that. I agree. I feel like that was even a question that had come up in our previous session about, message fatigue. And, I know that, when you are reaching patients via text message, it's not like that barrier there that may exist with, like, if you're calling a patient and then, you don't get to have that conversation with them because they maybe choose not to answer, or they, hang up or anything like that. The text message is going like directly to them. So there's this worry of like, oh no, like, are we being intrusive and things like that, or anything like that? But our programs are, built with that autonomy to where, like you said, patients can opt out. They still, do have that choice to engage with the text messaging, but then also it kind of intertwines with giving them that autonomy while also meeting them where they are, and saying, hey, you may not have had time for a phone call with us. Totally fine. But you may have your phone with you and you have like a quick few seconds to read about this important resource that we want to share, or reminding you about your appointment or a screening. So that's really powerful, and I think that that's definitely something. If I was hesitant, hearing that testimony for sure would make me say, okay, I think I can, we can definitely deploy this for our patients. So that was awesome. Thank you so much for sharing that. And now I think we have also reached that point in our session where I will now start to ask some questions that are coming in from our audience. So we have one here that is asking about saying that you are, knowing that you guys are unique as a tribal owned and operated healthcare organization, what feedback would you have maybe for other organizations who serve Native American communities in urban settings to ensure that they are delivering better care to Native American community members as well?
Oh, that's a little bit of a hard question. Yeah, I think that maybe just like making sure that you're kind of researching some of the history of Native American population. There's a lot of complexity that goes into the population and kind of like things that they've been throughout their lives. And I think just knowing a little bit of background on that could definitely help you to better serve those populations. And I think that's true with a lot of populations. If you don't fully, understand kind of where they've been and where they're coming from, it makes it a little different. I think just individualize the care, kind of meet them where they're at. There are a lot of Native American resources, like all over the country. So tapping into some of those resources that they may not be aware of could also be useful and helpful. So that's where I would start.
Absolutely. That was perfect. Thank you so much. Yes. I think you said something that really struck a chord with me too, and it's about acknowledging that lived experience aspect of it and understanding, the historical context and, um, approaching, communities with, like a sense of humility and just, welcoming and inclusiveness. I think is really, really powerful. And then also, yes, tapping into those resources. There's so many, valuable pieces of resources that are available for free as well, that you can lean into for ways on how to, respectfully engage with these communities in a way that also gives them a sense of autonomy as well too. So I think that was beautifully said. Yes, thank you so much, Elizabeth. I am looking. I believe those are all the questions that we have. Again, this was wonderful. This is a wonderful conversation. I really appreciate it. I hope the audience, you guys, got to take from this wonderful session some valuable pieces of information. And then I also think that Elizabeth struck a very, very loud chord with mentioning the experience that her organization has had with even using the CareMessage platform to talk about things like breast cancer screening with her patients as well. And with that, I wanted to even, take the opportunity to be sure that we're voicing that again, even though these conversations today may have been centered around colorectal cancer, we are working on wellness co-pilots to include topics like breast cancer screening as well with our women's wellness co-pilot that we're working on, as well as well child visits and vaccinations. So more things to look forward to from CareMessage, and more ways for us to support the great work that you're all doing as well. Oh, and thank you to Cecilia for dropping that information from the American Indian Cancer Foundation on those resources that Elizabeth was talking about. Yes, engage with wonderful things like this. And now